Hello everyone, welcome back to my YouTube channel. My name is Dr. Hamid, and in this video we're going to talk about celiac disease. It is very important topic for the preparation of USMLE Step 1 and Step 2, and I would say you should remember every detail, every single point from this topic, because a lot of questions they can make a lot of different scenarios from this one topic. Okay, so what is celiac disease? It is one of the malabsorption syndromes. Malabsorption syndromes, what we get from the malabsorption syndrome, that this condition would definitely cause diarrhea. Okay, celiac disease is also called gluten sensitive enteropathy or celiac sprue. Here, I want to highlight the importance of alternate names of the same pathology. A lot of times, what happens that we know the scenario when we read the question in the exam. When we read the question, we know that what disease or what pathology they are actually talking about. But when we read the options, we see that the name of the pathology which we know is not there. So what happens? They are using the alternate names. So here it is very important to remember the alternate names. Like celiac disease has a gluten sensitive enteropathy. It is an autoimmune condition in which there is an intolerance to a protein called gliadin. Now, what is gliadin? It is a gluten protein which is usually found in wheat, barley, and rye. So, if someone is intolerant to gluten, and if that person eats wheat, barley, or rye, or anything that contains gluten, then that person will present with diarrhea, fat malabsorption, weight loss, and symptoms of weakness and certain vitamin deficiencies. Okay, because we know that vitamin A, D, E, and K they get absorbed from the GIT. If a person or a patient, if a person has diarrhea, then those vitamins or important minerals would not absorb through the GIT and then lead to the deficiency of those particular vitamins. And if the patient has a deficiency of vitamin D, for suppose, will present with bone pain, osteoporosis, these could be the symptoms. Okay, this condition is associated with HLA-DQ2 and DQ8. Again, very important point to remember. Okay. Now, what parts of the GIT this disease is gonna affect? Distal duodenum. Distal means the last part of the duodenum, and or proximal jejunum, the first part of the jejunum, the initial parts of the jejunum. We know that the after stomach, we have small intestine, and the small intestine has three parts: duodenum, jejunum, and ileum. The duodenum has again four parts: first part, second, third, and fourth. So it in this disease, the distal duodenum and the proximal jejunum is mostly affected. And in those parts, the fat is usually absorbed. So when the person has celiac disease, the fat is not going to absorb and lead to steatorrhea. Okay. One very important thing is association of celiac disease. This disease has association with certain things which are outside of the GIT. Like if we see that a patient has celiac disease, we should also see the peripheries, the outside side of the GIT, what this disease can affect. Okay, so this disease has important association with dermatitis herpetiformis. Dermatitis herpetiformis is a skin condition. From the word dermatitis, it is very obvious that it is a skin condition, and usually in this condition affects the extensor surfaces of extremities, like elbow, which is very common area, and hips, or the extensor surfaces of knees, okay, or back. So in dermatitis herpetiformis, this is a skin condition that is associated with celiac disease, and it usually affects the extensor surfaces of the skin. Let me show you the diagram here. The diagram, and that's dermatitis herpetiformis. Look at this diagram. Okay, this there are four pictures. Look at the picture on the left top of the elbow, and this is very common picture which they usually show in the exams. Okay. Now, and what other things we see in celiac disease? Decreased bone density because of the malabsorption of vitamin D, increased risk of malignancy. Which kind of tumor? The T cell lymphoma. Okay. Now, what test we do in celiac disease? Certain important tests which they ask in multiple choice questions is the type of antibodies which we see in celiac disease. Three important antibodies which come positive in celiac disease are: number one, anti-tissue transglutaminase antibody. Second is anti-endomysial antibody, and the third is anti-gliadin antibody. Okay, these three antibodies come positive in celiac disease. The most common is anti-tissue transglutaminase antibody. Okay, here is the picture A is very important. Okay, I will talk about the histology. Let's first talk about this diagram, which is very important. Usually, we know that these are the epithelial cells, and we have villi. These are the hair-like extensions that helps in absorption of the food what we eat. Okay, but what happens in the celiac disease is actually, let's talk about the histology. Then you will understand this diagram way better. What happens in celiac disease is there is a loss of villi. What we see is a villus atrophy. Okay, villi are the hair-like extensions that are helping in absorption. When there will be villus atrophy, the food cannot get absorbed the way it was absorbing. Okay, second is crypt hyperplasia. Okay, these are crypt, and the third is intraepithelial lymphocytes. We will see a lot of lymphocytes inside the epithelium. These blue, look at the arrow, these blue cells, these are intraepithelial lymphocytes. Okay, and they're here they are showing the crypt hyperplasia. This diagram on the right side is very clear. Let me show you that one. I hope you guys can see on the right side. They are showing this villus atrophy. Okay, these are the crypt. Look at the arrow, crypt hyperplasia. Okay, a lot of crypts, and then these intraepithelial cells. Okay, so this is the histology finding of gluten sensitive enteropathy. Okay, now as we know that, now come back to this diagram. In this disease, we are sensitive to gluten, gliadin, particularly a gliadin protein, which is again a gluten protein. When the gliadin protein gets entered through the epithelial cells, it becomes de-amidated gliadin. Okay, and then it gets presented through the antigen presenting cells to the T cells, and the T cells then form T cell mediated formation of antibodies. Then they will form vast number of anti-tissue transglutaminase antibodies, anti-D-amidated or D-amidated gliadin antibodies, and anti-endomysial antibodies. So these three kinds of antibodies we see in celiac disease, that these three kinds of antibodies will be positive in celiac disease. Okay. Now, what is the treatment? The treatment is gluten-free diet. Okay. Yeah, this is all for celiac disease. Here, I want to emphasize on the importance of alternate names, on the importance of histology findings like villus atrophy, crypt hyperplasia, and intraepithelial lymphocytes. These are the histological findings in celiac disease. The third is what kind of antibodies gets positive in this particular condition. So, this is all for today's lecture. If you have any questions, you can just comment in the comment section. Thank you.